Hi students, this is your yoga anatomy lecture. So this is going to be pretty short. We just have 5 different images to go through, and you can find these images as a PDF on our Moodle course page, so you can come back to them for reference. Really, this is just an introduction to a few anatomy concepts that you will need to know to be successful for this course. And in our orientation sessions, we will talk more about some of this, and then as the video workouts continue, you'll get even a little more. So first off, you'll see this is some skeletal anatomy, and so lots of your sort of main bony landmarks are listed on this image, but there are a few that I want you to pay special attention to that we'll talk about throughout our course. Of course, the pelvis here, this large bone, and your sit bones are actually not labeled on here, but I want you to take a look at these very bottom points of the pelvis. So these 2 little points down here, from the front view, these 2 points down here. If you're sitting on the floor and you try to sit up nice and tall and rock a little side to side, you'll probably feel those 2 little bony parts digging down into the floor. Those are your sit bones. They're not separate bones from your pelvis, but they're just the bottom 2 points. And when those are pointing straight down, we know our pelvis is in a neutral shape. So you'll hear me talking a lot about that neutral pelvis and what does it mean. So you definitely need to know kind of the shape of your pelvis and your sit bones here. Then, since we're here, we'll talk about the hip joint. Hip is a ball and socket joint, so that gives you a lot of mobility to be able to move the leg, internal and external rotation, flexion and extension. And as we start to work in our standing and balancing postures, we'll talk more about the hip joint and what it can do. Moving down the knee joint, it's good to know that unlike the hip, which is a ball and socket, the knee is a hinge joint. So you shouldn't be rotating at all at the knee. It's just going to move through flexion and extension. So the leg joints also parallel the arm joints. So the elbow, just like the knee, is a hinge joint. And then the shoulder is a ball and socket, just like the hip. Now there are some differences. Usually the shoulder socket is much more it's less deep, it's more shallow than the hip, so you have even more mobility in the shoulder, but less stability. So we'll talk a lot about what muscles you need to engage to keep the shoulder in its correct alignment and to keep it stable. The elbow, like the knee, is a hinge joint, but it has a bony stop, meaning once you straighten out your arm, there's a little piece of bone in your forearm that stops your elbow from straightening out any farther. Your knee doesn't have that. If you look really closely here, you'll see you can actually see all the way through that joint. There's no bony stop. It's just the tendons and ligaments behind the knee that stop your knee. So we'll talk a lot in our standing postures, especially how the muscles along the femur here, the muscles of the quadriceps especially, help support the knee. So we want to make sure we're not hyperextending or locking out our knee, and you'll hear me talking about that a lot in our standing postures, and so that's why, because there's no bony stop, and we want to protect those ligaments and tendons. So other bones that you need to know, I'm sure you already know your ribs. Your sternum is this sort of flat part on the front of your chest where those front ribs all meet. Your clavicle or collarbone is coming across here, and then you'll see it better on the back view. Your scapula or your shoulder blade is sort of this triangular shaped bone, and we'll talk a lot about how your scapula are moving and how that affects the spine, especially the upper spine, thoracic spine, and then how your pelvis moves to especially affect your lower spine. So let's move on. Here is the spine. So a close-up view of your spine, you should know after you go through this. Your cervical spine is the neck, that's here. Thoracic, this is your upper back. Lumbar is your lower back, and then your sacrum is down here, and coccyx Oftentimes that's just called your tailbone. What's different about the sacrum is that the vertebra or the little pieces of the spine are fused together. So you cannot change the curve of your sacrum unless you were to break it apart, which of course you don't want to do. So the other three curves of the spine, lumbar, thoracic, and cervical, you'll see they are in these natural curves. This person is facing over to the right here. This will be where they're facing. And this is the curves of the spine that we want to maintain when our spine is in neutral, or we think about sitting up tall, or you've heard me explain why I don't like to say straight, because your spine isn't straight. It's in these curves. But in a lot of postures, we're trying to change these curves out of their natural alignment to something else. So think about if you're doing cow, the whole spine is trying to arch. So your cervical and your lumbar spine are already in those curves, but your thoracic spine is the opposite. So we're trying to get that upper back to arch as well in cow. In cat, the opposite is happening. Your thoracic spine is already in the correct curve for cat. You're trying to get your lower back, your lumbar vertebra, to pull into the opposite curve. And so you'll hear me reminding you in different asanas what curves you're trying to either change or if you're just maintaining the natural curves of the spine. So this might be handy for you to come back to a couple times throughout our course. So moving on, these are just some sideways and one back view of skeletons that have different posture alignments. So we're looking at the spine here. You can also look at the pelvis a little bit here, but mainly the spine. So A is your ideal alignment. You'll see the spine is in its natural curves. Cervical and lumbar are both curving towards the right. Thoracic is curving towards the left. Your sacrum is also curving towards the left, but as we already said, you can't change that anyways. So you'll see in B here, kyphosis and lordosis, these are exaggerated curves of the upper back and the lower back. And you don't have to have both of those. You could have just upper back exaggerated curve or just lower back exaggerated curve. C, flat back. You'll see here that's pretty straight through the back. And so this is not good for your spine. It wants to have these natural curves to give it some resiliency as you impact the ground and other things in your life. So we want to actually avoid this flat back sort of posture. D is sway back. So you'll see here how the lower back is a bit flattened out. The pelvis, if you make note, compare the pelvises in our ideal alignment to that sway back alignment, and you'll see the pelvis is rotated back a little bit. It's sort of like you've pushed your hips under and forward, and that tends to flatten out the low back, which also isn't good. That can lead to a lot of back pain. It often means your abs might not be engaging the way they should as well. And then E, scoliosis. So here, this is a sideways curve through the spine. And while a lot of these other alignments in B through D happen because of imbalances in muscular strength or mobility, oftentimes E, scoliosis, is just how you're born. You might have that sideways curve through your spine. And so we can do some things in yoga to try and help that. We might not be able to get rid of the whole curve, of course, but we can do some postures. So for example, you'll see the right side of this body is shorter because of how the spine curves. So we could do things that try to lengthen the right side of the body while compressing the left side to try and help that a little bit. But if you also notice here, the reason why we're talking about this is just so you're more aware of what might be happening through your own spine, through your own body, and then how that affects other things. So you notice here the right side of the hip is much higher than the left because of that curve through the spine. And so that can lead to a lot of different issues, some causing pain or discomfort throughout the legs and hips, of course. And so that's good to know. if you spend a little more time trying to lengthen that right side of the body, it might make a difference in helping that right leg feel a little better. And here we have a little more of a description of how the pelvis tilt affects the spine. So this posterior pelvic tilt, so this is, imagine the fronts of your hip bones pulling them in towards your belly, kind of tucking your hips under. You'll hear it said sometimes. And you'll see how that sort of flattens out the low back. We talked about that already when we talked about sway back in our last slide. And then anterior pelvic tilt, think about the fronts of the hip bones reaching towards the top of your thighs. And so that can increase the arch in your lumbar spine. But sometimes I might be cueing you to think about taking the fronts of your hip bones towards your thighs because you're a little bit the other way. You might not quite be in your neutral alignment, so I'm not trying to get you to overarch the lower back, but I'm trying to get you to that neutral and let your sit bones poke out behind you, because that's an important thing. If you notice here, sit bones are starting to rotate down here. And while in this image, your sit bones here, they're starting to poke out. So as we start to move into downward facing dog, this little bit of anterior pelvic tilt is going to be a good thing to practice to make sure you start to get your sit bones poking out behind you. That'll make a little more sense as you go through practice number 2. And then our last slide, some muscle anatomy for you. And you don't need to remember all of these muscles, but let this be a resource. You can come back to the PDF version of these. If I've mentioned a muscle in practice and you don't really remember what it is, the things I will mention quite a lot. Your deltoids are going to be the top of the shoulder muscles. Your trapezius is this nice, big, giant, triangular shaped muscle. You have on both sides, of course, so it's sort of like a diamond if you look at the whole thing. Your glutes are your butt muscles. There's lots of them. Hamstrings are the backs of the thighs. Quadriceps are the front of the thighs. And these are big groups of muscles. We could break them down more into gluteus medius, gluteus maximus. Quadriceps, if you know quad means 4, of course, are 4 different muscles there. Hamstrings, there's a group of muscles. Same with your calf muscles. There are groups here. Your Achilles tendon is connecting the calf down across the ankle. I know I'm going pretty fast, but I want you to be able to come back to this. I don't expect you to remember them all right now. Your iliotibial band, this is often called your IT band. It's coming down the outside of your leg, and we'll talk about insertion points and crosses later on when we get into asanas that are specifically targeting that IT band. But if you remember for now, down the outside of the leg, that's pretty good. All your ab muscles here in the middle, your rectus abdominis, these are those front muscles that give you that 6-pack or 8-pack look. Your obliques are coming on the side, and your transverse, this is a little hard to see where these lines are pointing. Your transverse abdominis are the deep internal muscles, so they're underneath those 6-pack ab muscles. And a lot of the times that is actually what we're targeting in our core work because they don't get worked a lot. And your transverse abdominis are very important for spine health to help stabilize, especially your lower back. Biceps and triceps, if you don't know those, are on the arm. Biceps are going to be front of the arm. Triceps are going to be the back of the arm. That says tricep there, even though it's cut off. So hopefully that gives you a little bit of a quick muscle overview. Feel free to come back to this as you need to, and I'll talk more about a few of these in detail, as I said, once we get into our asana practices where we're specifically targeting some of these muscles.